And sometimes we confuse lack of vocal speech with lack of intelligence. But I have kiddos who may not verbalize, but they can read.
Yes.
They can spell long words. They're so brilliant, but they do not have a means of getting all of that information out. And if we fund AAC, then we can give them the voice that they need.
Master Coach Apostle Courtney McLean and Business Coach Zidane Simister are powered up to share their expertise on the business end.
Welcome to another episode of The Business End. I'm your host, Zidane Simister, and here on The Business End, we provide real and practical solutions to advance businesses by speaking with experts in the field and existing entrepreneurs. Today, we are thrilled to have Lady Alexia Blair, the CEO of LO Speech Therapy Limited. Miss Blair is a distinguished speech-language pathologist with extensive experience working with both children, adults, and facing communication swallowing impairments. With her academic credentials from Nazareth College in New York and University of North Carolina at Greensboro, Lady Blair has applied her expertise across various settings, including schools, skilled nursing facilities, and hospitals. Her clinical interest spans a wide range of areas, including augmentative and alternative communication, autism spectrum disorders, dementia, dysphagia, fluency, and stroke rehabilitation. Now, help us in welcoming Lady Alexia Blair. Welcome.
Thank you so much for having me.
Now, tell us, how did you start your journey in pursuing a career in speech-language pathology?
For me, it's something to do with timing. Just as I was about to pick a career in high school, The King's Speech came out, and I'm ashamed to say how many times I've watched the movie. It's a really good movie. Yes. But within that movie, there is a king who has a stutter.
Yes.
And he worked with a speech therapist to help him give a wonderful speech at the end.
Yes.
And based on true events, don't ask me the details, even though I watched the movie many times. I just remember the good feeling and don't ask me the history questions.
Yes,
okay?
yes.
So I watched that and it inspired me to look into speech-language pathology.
Yeah.
And then I applied to different schools and I got in for speech therapy. I got a better scholarship for speech therapy, and you go where the money is, right? So I went in that direction, and then everything that I did kind of affirmed that I made the right decision.
Yes.
Like obstacles started clearing.
So in other words, you were drawn to a movie. You then realized that that was your divine call, and you decided to pursue that, and then you realized, listen, there is a lot of money into this particular field. So, in other words, this particular field you would encourage persons to get into it because of your call, or is it because of the money that is involved in it?
I think if you're doing it for the money, you're going to hate coming to work.
Why you say that?
Because I feel you have to have a love for it, because you're working with people who need help.
Yes.
It's not going to be sunshine and roses every day.
Yes.
You have to bring the sunshine and the roses to the job. So if you're just doing it for money, it's just going to be like, find another day. But if I deal with this image, always a cough, always a throw up on me, always a lick me, all that kind of things.
Yes.
But if you go in with like, okay, I get to help somebody today, then the money comes secondary.
Yes. So it is your passion to serve and to improve lives, and the end result of that improvement that has led you into this career. So you would advise anybody that is getting into a similar career or into a service industry that they must go with the passion to help somebody in order to make them a whole lot better.
Oh, yeah.
And that rewarding feeling is much more than the financial benefit that comes with it.
Yes, definitely.
Exactly so. But your education background must have helped you in terms of shaping you in terms of the strategies and just the whole speech therapy that you would have approached to the speech therapy that you would have used.
Definitely. So undergraduate was Nazareth College in upstate New York, very cold. And I had the pleasure of working with a clinical director she's very experienced, and she had a unique way of teaching. She always wore dresses, always floating along, and I struggled with behavior management in that growing up in Jamaica, we know you either shout at the picnic, you beat the picnic, for the picnic for the way you want him to do.
Yeah.
Right? Versus another approach where you change the environment.
Yes.
Okay, so I was working with a 4-year-old, and we were working on articulation. So she had to remember to she bite her lip to make the F sound.
Yes.
Right?
Yes.
And every session, she bouncing off the walls. And I'm like, I can't control this girl. Why these people don't raise them picnic for us? Listen.
Yes.
And it was stressful. And she gave me good advice. She's like, okay, you have to manage the environment. It's a big room. Make it small. I got great guidance that way. And now, even though it was an area that I struggled with initially, I think it's my strongest area now.
Yes.
And it's helping me because I get beat up very often by my kiddos.
Yes.
And because I know how to control the environment, then it is less beat up.
Let's be so.
Yes.
I recently observed a mother and her son, and she was experiencing something similar. Most parents just accept that they can't do anything and accept that that child is just behaving within the norm of their own environment and existence. So you would recommend to that parent, apart from coming to you, of course, the expert, but in home, you would have recommended to that parent that they must find some way to change their environment in order to facilitate.
Yep. The very first thing I target. I don't even touch speech therapy until I touch behavior management.
Behavior management.
Yes. Parents and Jamaican culture, we see a picnic crying, we're like, here, give me a sweetie, want a sweetie. Please don't do that. You're reinforcing the behavior, they're going to keep crying.
Yes.
You establish the boundaries, explain what you want them to do, and you reinforce that. You don't say you're going to do it one way and then they cry 2 times and you say, all right, fine, here, do what you want. You have to stick with it because what you're teaching is, okay, I know I can wear her down if I cry long enough.
But you would have worked in different settings. I'm sure you'd have worked in schools, hospitals, stuff like that. And the different environments would have posed different challenges and, of course, different rewards. You care to explain to our viewers and listeners, what are some of the challenges you would have experienced in those various environments and, of course, the rewards in those various environments?
Okay, so let's see. My favorite to date has been the skilled nursing facility, just based on the varied disorders you get to treat. And there's also a challenge with it in that you have to interact with different persons, different personalities. So it's a learning experience, but you get to hone that professional communication skill. So that was rewarding. With the, what's next? Hospitals, that's fun because I get to do more acute care. So that's right on the onset. For example, somebody had a stroke. I get to go into that room shortly after they've had the stroke.
Yeah.
And I like that because I get to see the early start of the progress. You go from not speaking, maybe today you learn to stick your tongue out. Tomorrow you might be making some sort of vocalization. The day after that, maybe I get an
Yes.
And we slowly build up until we're getting words, phrases, sentences. So I get to track that progress. It might be minute. It could be as small as they open their eyes today.
Yes.
Okay? Or it could be large in that they give me a full sentence. So I love hospital. Mostly medical things. I like medical things.
Yes.
With the schools, when I was in grad school, I worked at a public separate school, and that is it's like for kiddos that are strictly special needs, or if they're like medically fragile, they go to that school, and it had its ups and downs because maybe today you're working with somebody, or tomorrow they're out of school for 2 weeks, and then you hear they passed.
Yeah.
So you go with the flow.
Yeah.
So it's a learning process, and I think in that school is where I learned most of my strategies for working with my kiddos who have autism.
Yes.
And I learned how to use AAC, which I guess we'll talk about in a bit.
Yeah.
AAC is Alternative and Augmentative Communication, so talking with a device.
Yes.
Yeah, so no 2 days are the same.
Okay, understood. But I'm glad you mentioned the early phase on early detection when persons have minor strokes and stuff like that. I was also told that in terms of autism, that the earlier the detection, the earlier the diagnosis, is that it helps with the treatment and helps with the recovery. Is that true?
Helps with language development. So
Yes.
I don't want to say recovery
Yes.
or treatment because
Yes.
I'm trying to break that stigma.
Yes.
We're not trying to treat our kiddos with autism. We're
Yes.
trying to support them so that
Yes.
they can meet their needs, be academically successful, right? So detection, earlier you do it, the better. The earlier you start working with a therapist, the better. Unfortunately, we have 8 speech therapists in Jamaica.
Yes.
Everybody has a full caseload. So it's not that parents aren't trying to get that need met. It's just that the resources aren't there. What I've done is I've created a program, Unlock Your Voice program, for parents who are on a wait list.
Yes.
So that they can bridge the gap. While they're waiting to get into a therapy session, I'm teaching them techniques that they can use in the meanwhile. We've done about 6 sessions, and we do it on a monthly basis, so you can check that out.
And that's online, and they can sign up and come to these sessions, and they'll be able to help their own children and family members.
Yes, online. It's easier, greater reach. I have people signing up in the Bay.
Yes.
I've had somebody from Trelawney, so I guess it's a greater reach when it's online.
Could you repeat where they can find those sessions again?
Sure. So you register, you can contact us through our Instagram page at Hello Speech Therapy Ltd. So that's Instagram. You can send us an email, hellospeechtherapyltd@gmail.com. And our phone number, 876-823-2797. And we'll get you sorted.
Yes, I see the glow on your face, and I know that you enjoy the area in which you're in. So when you started your company, and Hello, very fascinating name for a company, Hello Speech Therapy Limited. What were some of your core values and mission that you started with?
Okay, so I like healthcare that cares.
Yes.
Because I feel anybody that I see, they are there because they need help, right?
Yes.
They're going through some struggle, and it could be my patient directly, their parents, or their loved ones.
Yes.
So everybody walking and they're nervous because they want to have an answer instantly.
Yes.
And my first thing is like, relax yourself. This is a no stress zone. So
Yeah.
I want everybody to be relaxed, and when you're relaxed, you're more likely to have conversation.
Yes.
You're more likely to bring up things that you ever go to the doctor? And when you walk out, you're like, forget to tell the doctor my knee hurting.
Yeah.
You need to kill you, but you forget because you're so nervous.
Yes.
So when you're relaxed, you're more likely to speak. You're more likely to express yourselves and say what's happening and get to the core of it. I'm very patient with, my first session. It's an hour. It's just an interview. We're having that conversation.
Yeah.
And I'm waiting for you to answer. I'm speaking with anyone involved, the parents, the patient, just to get that open conversation. And I want you to feel comfortable. So that's healthcare that cares. I think that really drives everything as I do.
It's all about the caring. It's all about the service. It's all about finding that solution for your clients and, of course, their immediate connection so that you're able to get to the source of the issue and be able to solve it on a long-term and sustainable basis.
Yes.
That is it. So I'm sure that the speech therapy encompasses a very broad area and broad range of disorders. As you would call it, and you don't want to be a stigma attached to it. But what are some of the approach that you would have done in terms of autism spectrum disorder or even stroke habilitation?
Okay, so with my autistic kiddos, I do a lot of play-based therapy. So they come into the therapy, and they lead my therapy sessions.
Mighty.
Yes, so they come in,
Yes.
they pick what they want to play with, and I follow suit.
You follow suit.
I follow suit. So let's see. Somebody came in. I have all these toys that I test myself to make sure they're good for the kids, right?
So you play the toys first.
I test them out.
Oh, okay. I see.
So
I see.
my kiddo came in and she picked the marble run, and we played with the marble run.
Yeah.
So I said, "Oh, look, the marble's going down.
Yeah.
Ready, set, go!"
Yeah.
And then the more I do that, I'm engaged, I'm excited, and she's having fun playing. She starts speaking. She doesn't even know she's talking, right?
Oh, okay.
So and then they leave. They reluctantly leave.
Yeah.
They leave kicking and screaming, but they don't even know they did therapy. They just thought they came to have fun.
Okay. Fun. Yeah.
And when you're not thinking about it too much, you get better results. Okay. So that's with my autistic kiddos. With stroke rehabilitation, it depends on my diagnosis. For example, if somebody has aphasia, I had a patient with aphasia this morning, and I've had him for a year and a half, going to 2 years now, and he's made great gains. When I first met him, he wasn't speaking, right? He nodded his head, and he got some yes and some no answers. Today we had a full conversation, told me about his family, went through pictures and told me who was aunt, uncle, cousin, everything, right? Yes, I'm still filling in the gaps. He's still doing some 2-word utterances, but I'm understanding him. He's able to express himself. He's actually gone back to work. We are working towards getting him back to work. Okay?
Yes.
So in therapy, a session with him, when we just started, I have an app. It has pictures, and we flip through the pictures I describe. So for example, it's a picture of a dog.
Yeah.
And he looks at it and he says, I don't know what that is. Or he shrugs and he's confused. I say, okay, man's best friend. See if I can jog some memory.
Yes.
Nothing coming up. I say, woof, woof. He goes, And I say, it's a dog.
Yeah.
Right? So you
Yeah.
give different cues to help
Yeah.
them get that. And what that does is it helps create these pathways in the brain or reconnect them.
Yes.
Right? And the more frequently you do that, those paths get stronger and stronger and stronger until suddenly I show him the picture and he goes, dog. No need for any cue.
No need for any cue.
Right? So that's an example of what I do with stroke rehab. Well, with aphasia.
Okay, understood. Now, you were mentioning earlier about augmentative and alternative communication. And I know this is a very fascinating area in that there are new developments in how you assist persons in communication and in speech. What are some of the advancements that has impacted your practice?
So with AAC, just to clarify, you can have high tech,
Yes.
meaning if I have my iPad, I'll have an app, you push a button and it says the word for you. So it might
Yes.
say play, go, stop.
Yeah.
It could be low tech. I have some pictures. You point to the picture you want me to give to you, okay?
Yes.
Or if you the picture you want.
Yes.
In terms of advancements, locally, I haven't had an opportunity to do too much. Abroad,
Yeah.
where you have health insurance that
Yeah.
covers all of these wonderful
Yes, yes.
expenses, I have seen eye gaze. So you have something that's scanning the screen. You can use, like, they might put a dot on your forehead,
Yes.
and you move your forehead to point to what you want, and you stay on that spot, and it will select go for you, okay? And that was, like, the coolest thing I've ever seen. In terms of pop culture, what is the name of the scientist? Stephen Hawking. Yeah, Stephen Hawking, he uses AAC. So he has, you always hear his, that speaky voice that he has. What it is he's pre-created those sentences,
Yes.
and then he hits play, and then that computer voice says it for him. So
Yeah.
that's like the pop culture reference for alternative and augmentative communication. Fun story. I'm always pushing AAC because you can start it at any age with anybody, okay?
Yes.
And research shows that when you use AAC, it doesn't replace speech necessarily, but it can help to facilitate speech in the future.
Yes.
So I have a kiddo I was working with, fresh, brand new, it's like our second session, and he loves letters. So I'm playing into him loving letters.
Yes.
So he comes in, he hands me Play-Doh, and he wants me to make different letters. So I'm saying,
Yes.
okay, I'm going to teach you how to say this, right? So on my app, we can select the word make, we can go to the alphabet, and we can select the alphabet. So
Yes.
I showed him, make P. Showed him a couple of times, there's a bit of pushback or everything, but then he eventually realizes that, oh, this is so much easier than stressing her out.
Yes.
Independently starts going, make, click, 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 F. We're going through multiple times, and then towards the end of the session, I wait him out. He goes, make P, and I wait. He looks at me like, why are you not making the P? And then I tap it, and it speaks. It says, make P. He looks at me, and he's waiting for me, and I'm waiting, and he's waiting, everybody's waiting, and he goes, make P. Like, okay, cool, we're gonna make the P.
Yes.
So we wait him out, and you can see real world. He made a 2-word sentence, and he done it independently, and he's used his voice.
It uses what?
AAC. Can't
Yeah.
stress it enough.
So let me ask you, if that is so useful and it is so helpful, why aren't we using it? And I know you make mention, why are we using it more? I know you made mention of the cost of it. Is there a case to be made to these insurance companies, or there's a case to be made to the various medical fund, maybe Chase Fund, maybe some other quasi-government institutions that could assist parents or just the wider Jamaica in finding the funding for these kind of programs, so that the children, or the persons, because not necessarily children, the persons who are affected by this, and then they will have a better recovery or a better improvement in their speech, as how you will put it. Is there a case to be made in that?
Definitely. And it's not to say that it's not happening, but I wish it would happen to a greater magnitude, and I wish it was less like pulling teeth. Because you might apply for the funding this week, and you might not get it until next year. And that's an entire year of progress that we've lost. Right?
I want you to use a minute or 2, 1 minute, and speak to that person that is listening that can make that difference in somebody's life. Speak to that insurance company leader. Speak to that, maybe it's that quasi-funding institution. Speak to 1 minute. 1 minute of life into that person. Why they need to put funding here.
Everyone deserves a voice, and it doesn't matter what that voice looks like. It might be verbal, it might be sign language. But we know that our kids gravitate to technology, and they catch on to technology so quickly. So I think it's definitely necessary that we have more funding put towards getting these AAC devices so our kiddos can access. And sometimes we confuse lack of vocal speech with lack of intelligence. But I have kiddos who may not verbalize, but they can read.
Yes.
They can spell long words. They're so brilliant, but they do not have a means of getting all of that information out. And if we fund AAC, then we can give them the voice that they need.
Excellent. 1 minute. And I'm going to add to that your voice, your power, your manifested power that God has inside of you may be trapped in not having that voice. And if you were to give that voice to that person, you were to give that voice to these children, then we will have a better Jamaica, more talent, more God manifested power, and we will see our kids, we'll see our talent pool increase and be better for it. And that is why you need to start funding AAC. Wonderful. There you have it. Now, given your experience in dysphagia and swallowing disorders, what are some of the common misconceptions about that condition?
My number one, everybody say, him all right, man, he might eat good. But then when you look at the patient, you see him short of breath, wheezing, or two days down the line, you hear him get a diagnosis of aspiration pneumonia. Right?
Yes.
So what happens with dysphagia is the patient has difficulty swallowing, and you have what's called silent aspiration. So they might not be coughing or hacking up a lung, because we like to say go down the wrong way. Yes. So, but what happens is it's gone down the wrong way quietly, and there's no immediate reaction. Okay. So what we do as speech therapists is that we train our patients to swallow more safely, or strengthen the ability to swallow, or give them compensatory strategies. So we might thicken their liquids, or give them puree versus the big old dumpling to eat, right? So I really just want everyone to just pause. When the speech therapist says hold liquids or hold solids, we're not trying to be the Wicked Witch of the West. We really and truly just want to make sure that our patients are safe and that they're tolerating their least restrictive diet.
And those are excellent words. Before you go, what the future looks like for you?
Okay, so I think I'm on a run of doing a lot more advocacy for my patients. It's hard to get the support you need when people don't know what is out there that needs the support. Okay, so you have to spread awareness so people know, oh, this exists. For example, I don't know if anyone's seen Paralympics. But I've seen people doing archery with their toes. I can't do archery with my fingers. What are you doing with your toes, right? And until you see that, okay, our people are capable of doing great things, then we won't know that we can fit in and we can help and support the way we need to. So for me, the future is advocating, being loud about it, supporting my patients in the best way possible, and letting people know that I have had the opportunity to work with some amazing people who are capable of doing great things. I want my patients who have had a stroke to know that they can go back to work. It might not be in the same capacity that they were working before, but you're 30-something, you had a stroke. The rest of your life is ahead of you. You need to buy food and all these kind of things. You can't just stay home all this time. You can contribute to society in a different way, right? And I want companies to understand that because someone's communicating differently does not mean that they cannot go to work anymore. Don't mean you have to make them redundant. Adjust. Reshape, reframe, refocus, and make them useful again.
There is life after an incident.
Oh, yes.
And so you would have done your practice, you would have learned the hiccups of running your own business along the way. Now, may not be in speech therapy, because you say you guys are few, but it may have some lessons that a viewer or a listener that is desirous in doing business and they want to know what lessons you have learned. In a matter of 2 or 3 lessons, what is that lesson that you want to let the potential business owner know in form of business?
Boy, the Alexia method has always been to jump.
Yes.
Jump with both feet. When I went to school in New York, I didn't have any family there. I jumped. North Carolina, didn't know anybody there. I jumped. Came home, didn't know how I was going to start working. I jumped. And when you feel a dream within you and you feel like very moved to achieve that dream, when you jump, you might buck your toe a little bit, but you will land.
Yes.
If you broke your foot, it will heal. You will recover and you'll learn maybe, okay, when I jump next time, I'm not going to put my foot in that position. I'm going to adjust. You're learning from your mistakes, but you're going to keep moving. You're going to keep moving forward. But you will never achieve anything if you do not jump. So you just have to jump and just lucky eye and hope so you land soft. If the foot broke it, all right, you'll figure it out. Just jump.
Just jump. Just do it. Just move and keep on moving. Where and how can persons find you?
Okay, so Instagram, Hello Speech Therapy Ltd. Email hellospeechtherapyltd@gmail.com. WhatsApp and phone calls 876-823-2797.
It was a pleasure to have you. Very informative, and I hope that information that you share here today would have impacted lives, would have rested in the hearts of many, even those funders and those persons that you're trying to advocate to give more funding and support to our persons that need such recovery. Now, this has been another episode of The Business End Show. You can follow us, contact us at The Business End Show on Instagram, YouTube, Spotify, and TikTok. You are the Business End Show tribe. You're literally the best. So continue to be your increasing best. Thank you.
Master Coach Apostle Courtney McLean and Business Coach Zidane Simister are powered up to share their expertise on the business end. But don't forget to tell a friend or a colleague, and of course have your tools on hand, your notebook and your pen. Classes are in session every Tuesday, 3:30 on Gospel JA for the business end. Master Coach Apostle Courtney McLean and Business Coach Zidane Simister await you.